Thank you again for dialing into our Ask the Doc wellness presentation about colon health with Dr. Estrada. Just as a reminder, all lines are muted until the question and answer portion of the presentation at the end. You are welcome to add questions to the chat or use the raise hand function. Please also stay on the line for the entire presentation as we will be providing raffle winners for participating today. And we'll get some of the names based on who is on the line at the end of the presentation. Our March wellness themes include nutrition, sleep awareness, and colon cancer awareness. All three of those wellness themes tie in together as our nutrition is as important for our overall health and fitness goals as it is for our digestive system. According to the American Cancer Society, about 107,320 new cases of colon cancer are diagnosed each year. The National Cancer Institute states that colon cancer is more prevalent in men than women, with both at the rate of new cases and death rates slightly decreasing year over year. They attribute it in part to the increase in screenings and lifestyle-related risk factors, especially in older populations. To teach us more about colon health and colon cancer awareness, we have our honored guest, Dr. Estrada. Okay, and to kind of give you some insight on Dr. Estrada, he is a double board certified colon and rectal surgeon who serves as the section chief of colon and rectal surgery and the surgical director of the Digestive Health Institute at Advocate Illinois Masonic Medical Center in Chicago, Illinois. Dr. Estrada is an assistant clinical professor in the Division of Colon and Rectal Surgery at the University of Illinois at Chicago. He also serves as core teaching faculty at the University of Illinois Metropolitan Group Hospital residency in general surgery. He is also faculty in the Department of Surgery at Advocate Good Samaritan Hospital in Downers Grove, Illinois. He has been an active member of local and national professional and scientific societies, such as the American Society of Colon and Rectal Surgeons, American College of Surgeons, Society of Surgical Oncology, American Society of Gastrointestinal Endoscopy, Society of Surgery of the Alimentary Tract, Society of the American Gastrointestinal and Endoscopic Surgeons, Chicago Surgical Society, and Chicago Society of the Colon and Rectal Surgery. He is one of the founders of the Medical Organization for Latino Advancement, MOLA. MOLA is a 501c3 nonprofit organization dedicated to working for career advancement, linguistic and cultural competency, personal wellness, and reduce health disparities for the good of the entire Latino community. Dr. Estrada's biography honestly could go on and on. We really appreciate that you are coming in today, Doctor. And what we want to do is just give you a big thanks for giving us some more information and insight about colon cancer awareness, which is really big and we're becoming more and more aware when we have physicians such as yourself giving us insight on this matter. So thank you so much again today. And I will now turn it over to you, and we will go ahead and do that Q&A after the presentation. Thank you.
Okay. All right. Well, thank you very much. That was very nice introduction. My mother would be very proud, and my wife would ask, "Who is that person you're talking about?" But it's a distinct pleasure of mine to be here with you guys today, even if it's in a virtual format. This is a topic that's near and dear to my heart. As some may know, March is Colorectal Cancer Awareness Month, and so the invitation to speak to this group couldn't be passed up in the month of March, because it's all about trying to increase screening and awareness about colon cancer. And as a colorectal surgeon, I've kind of dedicated my life to diseases that affect the digestive tract, but particularly those like this one that we're talking about today, colon cancer. And over the next 45 minutes, half an hour to 45 minutes, we'll talk about uh, things that are pertinent for you to know about colon cancer, how we can prevent it, and what your part is in this mission to kind of decrease the rates of colon cancer as well. And so uh, I'm absolutely excited to talk about a topic that's near and dear to my heart. Um, as was mentioned, colon cancer is a very common cancer in America. As you can see here on the slides, this is a little bit dated information before COVID, but the reason why I pulled this data is because COVID kind of skewed the data a little bit. But you can see in the amount of patients that are diagnosed with with cancer, nearly 150,000 patients are diagnosed a year with colon cancer. And that's quite a bit of patients. If you put that in perspective, that's about the population of Joliet. The entire population of Joliet every year will be diagnosed with colon and rectal cancer. It's certainly less common than breast, prostate, or lung cancer, but still a significant amount of patients are being diagnosed with this condition. More shocking is that of those that are diagnosed with cancer, colorectal cancer has a high risk of mortality or death related to it. About 50,000 patients die every year from colon cancer. And as a colorectal surgeon, this is probably the least favorite part of my job, is having to give that bad news. And particularly when we think about colon cancer, because colon cancer is one of those conditions that can be largely prevented if the proper steps are taken. Colon cancer, for most patients, is preventable. And for many patients, if diagnosed, it's curable. But there are some barriers that often make us uh, a little shy to go and talk to our doctor about colon cancer and the colon cancer screening. But you can see here it's a significant amount of patients. And I'm sure that since we have the audience muted, I'll kind of ask these questions as they come up for the group. But does anybody know somebody with colon cancer? With those kind of numbers, many people on the call would probably be raising their hand now or chiming in, yes, I do know somebody. And if we think about in the public sphere, there's been many celebrities, the most recent of which was been the Black Panther actor Chad Bosman was recently diagnosed with colon cancer. He has stage 4 colon cancer at a very young age. And I think that was a watershed moment for many people because that movie was such a phenomenal movie. It touched a lot of people's lives, but then they see this young, healthy, vibrant person succumbing to colon cancer. It's like mind blowing. But it's very, very common. As you can see, 150,000 patients a year are diagnosed. The next question is, wow, like who's here gotten screened, right? Has anybody gotten screened? And if so, how do you get screened? And what does screening entail for colon cancer, right? Who gets screened and who doesn't get screened? We're going to answer those questions today. Um, Along those same lines, who's had a colonoscopy, right? Many people have had the colonoscopy, and they can attest that, yeah, there's some aspects that are unpleasant, but for the most part, it's very doable. For other people, they're like, oh, I don't want to have the colonoscopy for this reason or that reason, and we're going to talk about what we can do in those situations. Who needs their colonoscopy? We're gonna answer those questions today. But we'll just start off with some background and statistics. So when we get to the question of does anybody know anybody with colon cancer, 1 in 22 patients, almost 1 in 20 patients, 5% of people will get colon cancer in their lifetime. And so we have more than 20 patients on this meeting now. And you can imagine one, maybe two of those patients that are on this call right now, if not properly screened, will develop colon cancer in their lifetime. And that kind of puts things into context. We're also seeing now that colon cancer is happening in younger patients. Traditionally, we thought that this was a disease for older patients, maybe 65, and then that's why we started screening at age 50. But it's actually happening in younger and younger patients, and that's what we saw with the actor that I mentioned earlier. It's happening younger.
Dr. Estrada,
Most, yeah,
one moment, just
please.
want to see if you can kind of go through some of the slides with us. I think it's just showing us on the first slide. Not sure if you
Oh,
had any of that data. Yeah. It
can
just
you
came
see
to my
that now?
attention. I can see the slide. Just want to see if you can get to any of the other slides. If you can start it for me, or
Oh, you want me to cycle through them?
yes, if you can cycle through each one of them so that the guests can kind of see some of the statistics and things you were speaking of.
Oh, okay, yeah, but can you see the content on the slides?
I can see the very first one, just not the content on the other ones you're speaking of.
You can only see the
The
1
very
in
first,
22,
I can only see the very first one. Yes,
and it says 1 in 22 will get colon cancer.
it actually is on the just your colon cancer awareness, the Advocate Healthcare.
Oh, it's not cycling through. Okay.
Mhm.
All right. Let me see.
Just the title
Uh,
slide, exactly. There we are.
Um, can you
Mhm.
see it like this?
Yes, I can.
Okay. It's
So
not.
you can either start, you can either, yep, there we go. You can either cycle through one at a time, or you can, yeah,
Yeah.
there you go.
Okay. So I had it in presenter mode, but I guess that didn't go through for the WebEx. Okay. So we'll do it
No
like
problem.
this. Let me see if I can make it a little bit more viewer friendly. So you don't have to see all the toolbars and things, but
This is fine. We can zoom in individually on our own as well.
okay, well, less than ideal, but okay. So as I was saying, so I'll back up a little bit. So this was the slides that you were referring to. About 150,000 patients develop colon cancer each year, and unfortunately, about a third of those patients will actually die of colon cancer, right? And so it's it's a national epidemic. It's something that we really do need to keep in mind, largely because it is preventable and it is something that, if detected early, is treatable. As I mentioned, it's very common. 1 in 22 patients will develop colon cancer. And we'll talk about some of the different screening modalities that we have available so that people can get screened and thereby lower the risk of colon cancer. Um, you still see my slides, is that right? Everything okay here?
Yes, they're fine. Yes.
Okay, perfect. Thank you. So this is kind of where we had that little glitch, and I apologize everybody, but for that. But as I started to say, that we are seeing it more and more in younger patients, and in younger patients and people, we need to kind of change our screening strategies, and we'll talk through that. Um, most cancers arise from polyps, and polyps are small growths in the colon that are benign. And so by removal of those polyps, we thereby reduce the risk of colon cancer. And then lastly, as we talked about, the rates are going have steadily started to increase with the amount of people that are being diagnosed. Part of that is because of the impact of COVID and people's access to healthcare. Part of it is also because we're doing a better job screening, but we're finding that the rates are actually increasing. Worldwide, over 1 million patients are diagnosed with colon cancer a year. We talked about the deaths, but of colon cancer, but as you can see here, about 140 patients die of colon cancer every day. And that's always something that really strikes me very, very um, powerfully, is that every day we lose a family member, a coworker, uh, a dear friend, somebody that is part of our community, to a disease that is largely preventable. And that tells me that we all have a job to do to increase people's access to healthcare access to healthcare, meet them where they need to be so that they can get screened, so that we're not having to give bad news. We're not looking longingly across the table where, our family member eats at Thanksgiving because they passed away from colon cancer that, as I said, is largely preventable. Most of these, if you are unfortunately diagnosed with colon cancer, a lot of these can be cured, and sometimes cured without chemotherapy, without radiation, but cured outright with early intervention. But the only way that happens is by detecting it. And these numbers, despite our efforts, don't seem to be moving. And so we need to do a better job. And to put things into context, by the year 2030, that's in 5 years. Colon cancer is estimated to be the greatest cause of cancer death in young patients, in 20 to 49-year-olds, and patients that are, you know, taking their kids to daycare, that are seeking career advancement, that are raising families, going on vacation. The kind of prime years are being robbed of these of our family members as this cancer kind of increases. And so it's a national epidemic, and this is a cutout from a newspaper article showing in the New York Times a couple years ago that we're finding that more and more young patients are developing colon cancer. So this is not just a disease of older patients. This is a disease that impacts everybody. Not only that, after that, we've lobbied with Congress, and we're able to successfully decrease the rate or the age of getting screened for colon cancer. Because this has become such an epidemic seen in younger patients, we need to move our screening strategies to a younger age as well. And we'll talk more about that in a moment. This slide's a little bit of a small slide to see from your guys's vantage point, but this is a American Cancer Society slide that shows the screening rates across the nation. So colon cancer is one of those things, as I mentioned, that if you screen, you can cure or prevent altogether. And so the natural answer to that is, well, let's screen more, right? And I think everybody would agree that we should be screening more of our patients. But as you look around, even our highest performing states with the best healthcare and they have the greatest access, they're not even screening their patients 75% of the time. I mean, they can only eclipse, let me back up. They can only screen about 75% of their patients that are screening age. In Illinois, we don't do quite as well. We get to about 62%, right? And this is what really compelled me to do more, right? How can we push that number up? Because the more patients that we screen, the less bad conversations I need to have with the family member, the less times that I need to tell them that you need to have surgery, the less things that less bad news I have to get. So from a very selfish reason, I was like, okay, we need to do a better job at increasing the screening rates. But before we can even get to screening, I'd like to just start with the basics, right? And so, what is the colon, right? We did a lot of these lectures directly to communities with people at their workspace, people at their church, at community events, and as a doctor, we're like, yeah, I get a colonoscopy. It's a test to check for colon cancer. But as we were talking, there were some people that didn't even know what a colon was or where it was in the body, and that one could get colon cancer. And so it became obvious that we needed to start off really basic for some of our patients, because they lead very busy lives and they're not medical, right? But the colon is outlined here in this dark red color here, and it's about 8 feet long in the body. its primary goal is to store stool after it's been processed from the food that you've eaten, right? It's about 8 feet long. It is not a necessary organ, right? In the sense that it's not a vital organ. Many people can live without their colon or portions without their colon, live very healthy and normal, productive lives without a portion of their colon. But it is one of those things that, as we said, is a location of very of the cancers kind of coming. And so that is the tail end of the colon here, right? And this is the part that we're talking about. This area on the right side of the abdomen over here, which is labeled the cecum and ascending colon, is responsible for absorbing liquid, and the rest of it is for processing and storing stool for a time that's acceptable to expel it. Um, what are polyps, right? So we had mentioned earlier, polyps are the precursors of cancer, right? And I apologize. I know this is a lunchtime meeting, so if there's people eating lunch, I apologize. There's a few pictures here that are less than appetizing, but these are representative pictures of polyps. And as I mentioned, polyps are small growths within the colon that can over time grow and develop into cancer. Now, these are the types of things that are depicted here that can be easily removed at the time of colonoscopy. And if we remove those things, then we also reduce your risk of developing colon cancer. And so again, this is just a picture of of the normal colon over here, and then these polyps developing into colon cancer. So with time, the polyps will continue to grow, and then they will change from a benign tissue to a tissue that has the opportunity to spread and cause blockages and other problems. Now, the next slide has some pictures of that, and so I warn you. This is a picture of a cancer within the colon. So the polyp had subsequently grown to the point that it's nearly blocking this. So this is the first panel on the left is normal, and then you can see this obviously angry red abnormal thing, and seeing a very similar picture on the third panel as well. These are representative pictures of colon cancer. And so this certainly gets everybody's attention, and they're like, I definitely don't want that, right? So how do we prevent that from being the case, right? And so there are certain risk factors that we are all at risk of developing colon cancer. And by decreasing those risk factors, you could potentially decrease your risk of developing polyps and thereby decrease your risk of colon cancer. So who's at risk? Well, anybody listening to this conversation today is at risk of developing colon cancer if they have their colon. So anybody with the colon is at risk of developing colon cancer. What are those risk factors? So the risk factors goes up as we get older. So the risk factor significantly goes up starting around 45, right? 50 years old. That's why we recommend doing screening tests at 45 or younger, depending on your history. Secondly, if there's a family history of colon cancer, and this was one of the things that many people, when we were doing our community events, they would share with me, they're like, well, we don't talk about these things in my house, right? But it's vitally important that you know what the history is of your brothers and your sisters, your mother, your uncles, your aunts, so that the doctors can properly screen you to prevent those things from happening, right? And so if you have the access to those family members, I would encourage you to ask the questions. Hey, what happened to Uncle Jack? What happened to Aunt Mary? What happened? What kind of cancer did they have? So that will better arm you and prevent you from developing colon cancer. Because if you do have a family history of colon cancer, we recommend doing colonoscopies and screening methods earlier. There are things that you could do on your everyday life, right? Number one is diets that have lots of red meat or have a fatty diet. So a more typical American diet is more likely to develop colon cancer. Diets that have more fruits and vegetables, whole grain oats, things of that nature, reduce your risk of colon cancer, right? So this is often a challenge because sometimes, particularly now, fruits and vegetables are so expensive, right? But by not eating those things, you place yourself at an increased risk of developing colon cancer in your lifetime. Smoking is a risk factor for cancer. Many people think of it just in in lung cancer, but it increases, smoking alone increases the risk of cancer throughout the entire body, but it has a profound effect on your risk of developing colon cancer. And the same is true with alcohol. Um, Alcohol can increase your risk of colon cancer. Well, both of those habits are poisonous to the GI tract, and as such, they can lead to the development of polyps and the development of cancer. If you had polyps in the past, that means you're more likely to have polyps in the future, and thereby, if you have more polyps in the future, you're also at risk of developing colon cancer. Um, People that are overweight. Now, I say that as somebody that also needs to lose a few pounds, but as our body weight increases, the risk of developing polyps and cancer increases as well. So that's why it's so important to try to decrease our weight loss, to exercise regularly, and do those things that keep us healthy. Kind of, if you want to prevent colon cancer, it's kind of doing the things that mom told us we're supposed to do: exercise, sleeping right, eating your fruits and vegetables, drinking water, all those things are really healthy to prevent colon cancer and healthy for your heart and your lungs and everything else. Those are the risk factors. And many patients will tell me, hey, you know what? I already live a really healthy lifestyle, I eat a lot of fruits and vegetables. Why do I need to get a colonoscopy? Why do I need to get screened? I feel great. I don't have any issues whatsoever, right? And they'll say, you know what? I don't have problems with my bowels. I never see blood. My stomach is rock stable. I can eat anything and I don't have any problems with pain or anything like that. I'm not feeling weak or tired or anything. Now, while those symptoms are common for colon cancer, those symptoms are usually late stage findings of colon cancer. And so when you're experiencing those symptoms, it's often much later and sometimes, unfortunately, too late. Most patients have no symptoms at all. And that's why it's so scary. This cancer in particular is that you feel great and you're doing all the right things. And so it doesn't make sense why I would go to the doctors and have a test on a private part of my body to make sure that I don't have colon cancer because I feel fine, right? And that's often the struggle with patients, and to kind of convince to them that, this is one of those things that we really do need to address, because the first symptom could be no symptom at all. And so that's why it's so important to try to live that healthy lifestyle, fortify your diet with fruits and vegetables, get the family history, and then when the time is right, to get screened as well, even if you feel normal. Most colon cancer is survivable and curable. So this slide actually shows you that if diagnosed at an early stage, most people, we can cure them. A 5-year survival is over 90%, right? And so this shows you the progression of polyps growing into cancer. First, it starts right over here where it says polyp, and this is where most of them start from. 95% of patients that develop colon cancer develop it from a polyp. And then it starts to grow a little bit bigger, but it's still confined to the inside of the colon. And so we can still snip these ones out pretty easily at the time of colonoscopy. This one, it starts to invade through the wall, but maybe hasn't punched all the way through. This is one where that we could potentially cure with surgery. This one, a little bit more advanced, but still hasn't punched the wall. Again, might be curable just with a simple surgery. But lastly, this is the one that is gone through all the way through and started to spread either to the surrounding lymph nodes or to the distal organs as well. This is the one that we often think about. These later two groups are the ones that we are often saying, well, that I have bleeding, I have weight loss. These are the patients that present with symptoms. These ones over here, no symptoms at all. The vast majority of patients can be caught in this area with proper screening. So you've heard me talk about screening, screening, screening. What is screening, right? How do we get screened? And if we were in a more open forum, I'd poll the audience and somebody would stand up and say, colonoscopy. And that person would be right. Colonoscopy. And so this is a goofy little cartoon, but colonoscopy is the right thing to do, right? It's the best test, right, from a cancer prevention standpoint, because it prevents the development of cancer and it looks on the inside very thoroughly, as opposed to some other tests that just detect it when the cancer is present. A colonoscopy can detect precancerous stages and can treat it at that same time. It usually takes about 20 minutes to do. You will be sedated. You won't remember or feel a thing. It does require you to cleanse your colon. And so that's often a barrier to getting a colonoscopy, right? You have to drink a drink, it's going to clean your colon out. But there's a lot of new options now that make that process a lot easier. But typically, we put a small camera into the body and we look within the colon to see if there's any of those polyps or growths that are visible. And if they are, then we can remove it. If it's even a little bit further along, maybe it's not a polyp, but it hasn't fully turned into a full-fledged cancer that can spread, we can remove it and cure you right then and there. And so not only is the colonoscopy a check to see if everything's okay, it's also it serves as an opportunity to intervene and to treat. As I said, it takes about 20 minutes to do. The vast majority of patients choose to have it with sedation. You can do it without sedation, right? It's not a painful procedure in the sense that you are going to be buckled over pain or anything like that. That's why some patients, for various reasons, choose to do it without sedation. But the vast majority choose to have a nice little nap. You get a nice nap. The doctor does the test. It takes about 20 minutes. They wake up, they feel refreshed, and then we tell them what we found. The colonoscopy, this is a picture of us performing a colonoscopy. You'll start an IV in your hand or your upper extremity. You'll get some light sedation. The procedure's done. This picture here shows the colonoscope. It's a graphical presentation of the colonoscope or the camera going in. This is the polyp, and we put a small little lasso around the polyp and remove it. It doesn't cause you any pain. You're not even aware that that polyp is there, nor are you aware that I'm removing it. Here's here's a picture of a polyp at the time of a colonoscopy, quite small. This is just a couple of millimeters in size. And then you can see here very faintly, there's a little instrument pulling the polyp out, just plucking it out like a hair. And by doing those maneuvers, it reduces the risk of that polyp turning into cancer. So as I mentioned, one of the biggest barriers is the prep, right? A lot of people are like, okay, I get it. This is preventable. This is curable. But there's so many barriers. You know, I got to drink that drink, right? I don't want to drink the drink. And in the old days, we would give you this big old jug of fluid right here, and it's a gallon fluid, and you drink it and you choke it down. You're like, oh my God, this is terrible. And many people would be like, oh, I can't do this, and they'd get nauseous and upset to their stomach. And that was the gold standard for many, many, many years. But because it was so unpalatable, we have other options now where you're taking literally maybe 2 shot glasses of medicine, followed by a lot of water, but nonetheless, just a couple shot glasses that taste like maybe like a cherry or fruit flavored medicine. And then it does the same thing as the larger medication, but it's a lot easier to take, right? Most people will say, well, I can't take the prep because I got to work the day before. This is something that you can do in the evening. You don't have to do it all day long. You do it in the evening time after work. So if you work a traditional 9 to 5, you can do it once you get home around 6 or 7. You take the drink, you finish by 10. It kind of runs through the system, and many people are able to go to sleep, wake up, and come to the hospital and get their tests done. And with the smaller version, perhaps it's a lot easier to take now. The taste isn't so bad. There's actually even a pill form for the properly selected patients that you can actually take a pill form of it where you take a bunch of pills that have the same effect. So if you don't like the taste of the liquid or something like that, there are other options. So a lot of advancement has been in that regard. But there's still barriers, right? There's still barriers. You got to take some time off of work. You got to get a ride. And we were working on trying to increase our screening rates because as you saw before, the state of Illinois, our screening rates were about 62%. And this was one of them, was the prep, right? Second one was, well, I got to go see the doctor and then they're going to schedule me. And so one of the things that we created at our institution is the ability to actually schedule the colonoscopy directly, right? You don't have to see the doctor beforehand. You can call the colonoscopy hotline, and that's called our direct access screening colonoscopy, so the DASC program, where you can actually call the hotline, but throughout your busy day and just say, hey, I need to get a colonoscopy. They'll ask you a series of questions and see if we can just schedule your colonoscopy, work with your insurance, work with you, find the right day that we can do the colonoscopy and save you the unnecessary appointment with the doctor. Everything gets called in and it kind of streamlines the process. Another barrier was, well, doc, I work during the week and I can only do my colonoscopy during the weekends, right? So then we opened up Saturday colonoscopies for patients so that they can do that as well. But there's always a barrier, right? There's for some people they just will not do it. They're like, I don't want to have an invasive test. I don't want to be sedated. I don't want to ask somebody for a ride. I don't want to take time off of work. There's still other options. And when we think of those other options are looking at the stool itself, right? So there's different tests that we can actually send you home with and you can do on your own. A stool-based test, you send a sample of your stool into the lab and they analyze it and see if you're at risk of um, colon cancer, right? But there's two different ones. The first one is the FIT test, FIT, and that's looking to see if there's elements of blood in the stool that you can't detect with your naked eye. So it's microscopic blood loss. And so if there is, that usually means that you might have a polyp or a growth there that needs to be taken care of. And in those patients, if you do have a positive stool-based test, we recommend a colonoscopy. If it's negative, then you get that stool-based test every year. Now, this is not as good as the colonoscopy. It's not as sensitive. So there are some people that develop polyps in the absence of blood, right? And there are some people that will only opt to do this test, but you have to keep in mind that it will not remove any of the polyps. It just detects the presence of blood, which implies that there might be polyps and or cancer. So in some regards, this is detecting it after you've already developed a problem. There are more sophisticated tests. You might have seen Cologuard, and that's where there's a commercial of a walking box and talking about colon cancer. That actually looks for DNA in your stool that suggests that there's findings of polyps or cancer. That's a little bit more effective because it's more targeted, but again, it's something that has to be done regularly every 3 years. And if it's positive, you still have to get the colonoscopy. It's not curative, it only detects. So the same problem applies. It detects but doesn't cure. If you had your colonoscopy, you don't need to have your colonoscopy every year. If it's totally normal, you don't need to do any testing for 10 years. So you're good for 10 years. That's how much better the colonoscopy is compared to these tests. As of 6 weeks ago, there was a newer option as well that looks in the blood as a blood test. Now, the insurance is not all insurances are covering this test, but in the near future, in the coming years, there'll also be a blood test detecting to see if you have any signs of colon cancer or colon polyps. Again, it's not 100%. It's not curative. So if there is a positivity, you'll still need the colonoscopy. I might sound a little biased, right, towards colonoscopy. It's just a much better test. But at the end of the day, I tell my patients the best test that for colon cancer screening is the one that gets done. So if you don't get any of them, if you're unwilling to get a colonoscopy, these are suitable second options, right? But at the end of the day, we need to get everybody screened, whatever they're most comfortable with. There's also, if you look online, there's X-ray tests that will look to develop for colon polyps, and that's what we call a CT colonography, right? A CT colonography is a test where they do an X-ray test, like a CT scan, to see if there's any polyps within the colon. You still have to take a bowel prep for this, so you still have to drink the medicine. And if there's anything positive, you still need to have the colonoscopy. So very few places offer this. But that is something that you might come across as well. But again, as I said, the best test is the test that gets done. And so as we think about colon, we all have a responsibility to, we all have a responsibility to do our part, right? That first part is to make sure that we get screened. But that second part is to make sure that our loved ones get screened, right? And today, my hope today was to let you know what colon cancer is, let you know it's preventable and curable, and that there's different options that we can do to screen patients. And it doesn't necessarily have to be a colonoscopy, but we do need to screen our patients so that we don't have to give bad news. We don't have to miss our uncle, our aunt, our dad. We can still keep everybody, our community safe and healthy and enjoy our life to its fullest through a very simple test. And so my ask to you is, if you know anybody that needs to be screened, let them know there's a lot of different options that you can do for screening, for colon cancer screening. Do your part, right? Help me save a life. You save a life. Your word matters a lot too. And so I think we all have a role when it comes to this. And if you haven't been screened, um, there's a lot of different options to get screened. It may be a little scary the first time, but go get the test. If you're having symptoms, tell your primary care doctor. Let your doctor know that something's not quite right. It's so treatable. It's so curable. We do not need to have more patients being diagnosed with colon cancer. It can be something that we can stomp out altogether if we all do our part. And so I wanted to leave a little time, and it looks like we have about 15 minutes or so for questions. And so I'll leave it here. I'll stop here, but I'm happily answer any questions that might have come through the chat or anybody that has any questions that they need to ask now.
Hey, yes, well, just really quickly before we do, Dr. Estrada, we want to thank you for an absolute great presentation. You've given us so much more insight, on this matter and about colon health. And so, yes, we will now open up for Q&A. Basically, participants, you can decide whether you want to unmute yourself or type in the chat any of the questions that you may have. If you do type it in the chat, we'll try to just moderate for you and ask the question out loud. So then Dr. Estrada can take the time to continue the conversation.
Yeah, I'll start with the chat first. I'll go one to the chat, and then if anybody wants to mute, I'll give you a second to unmute, and then we'll just kind of do it that way. We'll go back and forth. There was a question here about do you, I'll read it aloud for those that can't see the chat, but do you know how coconut oil and olive oil affect or help the colon? So when it comes to coconut oil or olive oil, right? Those things don't necessarily decrease the risk directly to colon cancer. However, um, they do aid in the ability to move your bowels regularly, right? And so that's how they primarily do. It's not a part of a treatment option or a preventive option. However, olive oil and coconut oil are healthy oils that get synthesized down, and those byproducts of the oil do feed the colonic gut, but directly they work more as laxatives and lubricants so that you're more likely to have more frequent bowel movements, but that doesn't necessarily have a direct effect on colon cancer. Um, so I can go on to the next one, or if there's a question from the group, you can ask your question now.
We
All right.
do have from the next question from CM Winford.
Okay.
Are colonics beneficial or safe?
So colonics are something that's very popular in the public, right? People will attest that they feel much lighter. They feel like it is one of those things that feel like their digestion is better and they feel more healthy with doing a colonic, particularly if they have altered bowel movements. So colonics used sparingly, there's probably no harm in doing a colonic, right? But certainly, do they decrease the risk of colon cancer? Not necessarily. Um, that's number one. Number two, um, if so they don't necessarily decrease the risk of colon cancer. Number two, are they necessary? It's one of those things that it's not necessary either, but many of my patients um, feel like they have a more gratifying bowel movement following the colonic, and they feel like it's something that they want to be part of their kind of health maintenance. There's probably no harm in doing that with if you do that, kind of you're not relying on the colonic to have bowel movements. If you're having issues with bowel movements, you're probably best to bring that up to your doctor, but a colonic in itself is not necessarily a bad thing, and it doesn't necessarily decrease the risk of colon cancer. I'll go to the chat box here for the next one. It says, my husband had not one symptom of, I'm assuming, colon cancer. My buddy, she worked with the CTA. She was a bus driver. She started a colon cancer coalition. She actually started the Blue Hat Coalition, which I know Candace quite well. She and I have worked together on many projects, and we've done a lot of speaking engagements. She's absolutely phenomenal, and she did survive it, and she has beaten it. And it her message, as our message, is to catch it early, right? So be on top of things, and talk to your family members, and so yes, it hits close. I mean, it's people who we work with. The Cologuard Golf Classic is this weekend, so there's a little plug for the Cologuard Golf Classic, and they want to invite everybody to do that, to join if they're interested, to honor their beloved husband. Is there a question that you have, Johannes?
We had another here from Tamara.
Okay.
Just a quick reminder, you all, we have set the settings to unmute yourself if you'd like to unmute yourself and ask your question out loud. Again, you don't have to, you can type it in the chat, but just a reminder. But again, this question from Tamara is, I'm not sure if it was colon cancer. I literally found out yesterday that one of her friends she went to college with died of cancer. He was the epitome of health, six pack and all at 60. It's a crushing blow. So it's a comment that she made there. Yes, Tamara, we want to give our condolences.
Yeah, and this is one of those things that's just so shocking to see. Like we see your friend who's just looks like he's doing everything right, and then all of a sudden this uh, diagnosis of this is just, it's like you said, crushing.
We have a couple of people that have their hands raised. We
Yeah,
have
go ahead.
Valencia Davis.
Go ahead, Valencia.
Okay, quick question. I
Yes.
get the colonoscopy, but I have to do it every 5 years because every
Yep.
year they find one or two that are really tiny. So,
Uh-huh.
is there a point in my life where I go and they won't find one?
Yes. So there is a so so as I mentioned before, patients that have polyps are more prone to develop polyps, right? So we want to keep a close eye on those patients, and that's why they got you on a 5-year plan as opposed to a 10-year plan. And every time that they find a polyp, they don't want to stretch it out longer because those polyps, granted, are small. There is a risk that they can develop into cancer. Yes, I've had patients that have had colonoscopies and they found polyps 2, 3, 4 times, and then the next time there's nothing. We cleared it all out, and so it's possible, yes, that you can get to a point where you don't develop any further polyps, and then that they can give you a longer course of action as opposed to every 5 years, maybe a little longer than that. But yes,
It
but
started
I
off
applaud
with
you for.
it started off with 10, and then after that it became 5.
Yeah, so exactly, right? So yes, if you're doing the right things, Valencia, and they got a good look at the colon and you're not having any problems, you might be able to get back to that 10-year mark. So
Okay.
keep working at it.
Okay.
But I applaud you for doing the colonoscopy and staying with it.
Well, as you were talking, you pretty much was answering questions that may have arose from what you was talking about.
Yeah, I've done this talk before.
Well, thank you. Great job.
Thank you. All right, let me see. I'm going to go back to the chat box here.
We have Jay that is there. That has
What can you looking for? Hold on.
What was that, Jans?
there is a Jay that is on the chat. Jay has mentioned, I've had 2 colonoscopies. The first, they found no polyps. The second one I
Yes.
had this January and had something he wasn't even sure was a polyp, but he removed it. It was thankfully benign, so I don't need another one for 10 years. My question is, 10 years is a very long time. How are they reasonably optimistic that something won't happen in those years in between?
Yeah, so that's a great question. I do have some patients. Sometimes the issue is not that they don't want their colonoscopy; they want it more. They want it more frequently because they're like, "Hey, I don't want anything to do with this," right? Um, and so, how do we know that you don't need another colonoscopy sooner, right? A lot of things go into that calculation. One, your family history, right? Two, the types of polyps that you had in the past. Now, we didn't get into the details of those in our conversation, but there are some polyps that carry a higher risk and some polyps that carry little to no risk, right? Three, the quality of the colonoscopy. So if the colonoscopy was a complete colonoscopy, if the cleanse was a good cleanse, they got a good look at everything, then they can reasonably say, hey, you know what, you're low risk. The colonoscopy was virtually normal, and we had a good look at everything. You don't need another one for 10 years. I certainly think that without looking at your medical record, you certainly don't need one for 5 years. And then the polyp that they saw that they weren't quite sure was a polyp was probably a false alarm. And when we're doing colonoscopies, we will often look to see any abnormalities. And if there's any question, we'll go ahead and remove it. And then the lab will tell us whether or not it's a true polyp or not. So it was probably of that nature, in which case that doesn't count against you as a true polyp. And that would be a normal colonoscopy, thereby saying that you would need another one in 10 years. But I don't know that anybody would fault you if you're like, hey, it's been 5 years and you're like, hey, you know what? I had some polyps in the past. I'd like to get a colonoscopy. I think most endoscopists would go through the records and be like, okay, I think it's reasonable to do it sooner, considering the issues that we said. But the truth of the matter is, you probably, based on the information that's available, 10 years is probably fine. I wouldn't go longer than that. 7 to 10 years is kind of that area. So if you wanted to bring it down to 7 years, you wouldn't have any problem whatsoever to get that done. There's a
Okay.
comment here saying, I'll read the comment out here. I was so nervous when my doctor referred me for a colonoscopy. I drove myself crazy with worry, but it was really, but it really was painless and the staff was great. Wish I had the benefit of the session beforehand. But I think that speaks to the point is that we work ourselves up and this is invasive test and it's a private part of the body and I got to drink a nasty drink and blah, 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 blah. And then you get through it and you're like, oh my God, that was a breeze, right? I'm not gonna tell you anything that's not true. Yeah, the prep sometimes sucks. I had my colonoscopy, right? And it's doable, but the alternative is, polyps, problems with my bowels, cancer. Like, yeah, okay, I'll do that and do it every 5 to 10 years versus getting chemotherapy, radiation, surgery, a possible need for a bag. I mean, these are just, oh, I'd much gladly take that chance.
We have a couple more questions. One person that had their hand raised, the T Cargo at Transit Chicago, and I
Yeah,
think
that's
they're
Okay.
unmuted. Yeah.
that's me,
All right, go
Tracy.
ahead.
That's Tracy Cargo. Can you hear me?
Yes.
Yes, we can hear you just fine.
Okay. I'm the one that was talking about Candace. Me and Candace are childhood
Yes.
friends. And you made a comment about the colon guard. You said it had something to do with DNA. And the only reason why I'm questioning, I'm trying to figure that out is because my husband took the colon guard test first, and that
Uh-huh.
was a year. And then a year later, to me, he just didn't look right. So I asked
Uh-huh.
about the colonoscopy, and
Yep.
his doctor allowed him to have the regular colonoscopy, and that's when they
Yep.
found the cancer. But
Yep.
colonoscopies, according to where you have them, can be kind of expensive. So, I mean, okay, so you say the colon guard is the DNA and it's probably like the,
So I can answer that. I think I know where you're going with it, and I
okay,
can kind of
yeah,
help with that. So you're right. Colonoscopies can be expensive, but there's new legislation stating that if you need a screening colonoscopy, right?
mhm,
A colonoscopy without symptoms, the vast majority of insurances will cover that as a preventative measure. It's like going to see your primary care doctor. It's kind of bundled into that. It's a regular health maintenance thing, right?
okay,
So, so that's number one. There are going to be now everybody's insurance might be a little different, right? Where you might have a small copay, somebody else might have a larger copay, but you're not going to have to shoulder the cost of a full colonoscopy with the legislation that's in play.
okay,
So that's number one. Number two, the DNA in the Cologuard, right,
mhm,
is looking at the DNA of the polyp or the growth, right? And it's dependent upon the sample. So sometimes, and somebody just chimed in saying that the CTA insurance covers a colonoscopy at 100% with no copay. So there you go. Thank you for that comment. The Cologuard looks for not your personal DNA, but the DNA changes of the polyp. And that's the problem with the Cologuard, right? It's not the best test.
correct,
That's why I kind of led with the colonoscopy. The colonoscopy is the best test, has the highest rate of detection, has the highest rate of cure. A Cologuard, a stool test, has a lower rate of detection and also has false negatives, which may have been the case in your husband's case,
it was,
and and does nothing for prevention. It just detects, right? And so if you have all things being equal, the best test is always the colonoscopy because not only can we see it directly, we can take a good thorough look at things. There's no sampling error. It's very clear and obvious. We can also treat it. We can also potentially even remove it at that time. Whereas the Cologuard does have false negatives and false positives. And unfortunately, in your husband's case, it sounds like it might have been a false negative.
it was.
And that's the problem with the Cologuard. But as I said, the best test easily colonoscopy. But a suitable second test would be any of the stool-based tests because any test is better than no test,
I just
right?
wanted you to say that. Thank you.
Yes.
Okay, really quickly, just because we have to be mindful of time, I do see Beth's question, but we do have to wrap up now. Beth, my apologies, but what we'll do is we'll try to see if we can get that question answered to you by the doctor and maybe get an email going for you to answer that question. But we again, we have to be mindful of the doctor's time. So we do have a few announcements and reminders for you guys. This is a self-reported activity for Motivate Me. So please be sure to report today's date on the MyCigna app. You can also find more information about Motivate Me and our wellness programming on our website at transitchicago/wellness, transitchicago.com/wellness. Without further ado, I'd like to announce our raffle winners for participating in today's seminar. If you hear your name, please email us at wellness@transitchicago.com with your badge number and work location. We'll pack up a prize for you. So congrats to the winners, which are Tomanika Watson, Jorge Moreno, and Beatrice Coleman. So I'm going to say that one more time. Tomanika Watson, Jorge Moreno, and Beatrice Coleman. So you guys remember, again, we need you to email us at wellness@transitchicago.com with your badge number and your work location, and we'll pack up a prize for you. This will now conclude our presentation. Thank you all for joining us, and be well and have a great day. Thank you, Dr. Time. We truly appreciate everything that you've given us today.
Thank you,
for
Dr.
having
Estrada.
me. Yeah, thank you for having
Thank
me.
you.
Very engaged group, and
Great.
happy to be here. Thank you.
Thanks.
Bye now.